A lot of teenagers don't realise, or they don't like to mention, and parents feel very embarrassed to point out that there might be a problem. So it becomes an issue where, do I say anything about it? Do I mention that it's a problem? Because we all worry about tipping our teenagers into more anxiety, body, self-esteem problems. But the important message, I think, is that if you leave it too late, you can scar, and that's a much more difficult thing to treat, acne scarring, than actual active acne. The important message to get across is to come in early rather than leave it too late. What can we do to help it? It's important to find out that it is actually acne. Acne can vary from very mild blackheads, a bit of an oily tendency of the skin, right up to the severe, moderate to severe acne, which involves cysts and great big lumps around our jawline. These type of grades of acne often require a referral to a dermatologist and an early access to the big drug we all know about. But if we get it in the early stages, we can actually prevent that from happening. So my message is to act now. Don't delay it. Don't delay it 3 or 4 months until we're all in a less stressful environment. Come in and visit us and we can talk about what we can do to get on top of it early. The things we can do involve looking at the diet, looking at the stress levels, considering the teenager as a whole medical person, not just the skin in front of us, because there's a lot of things that happen inside us that make acne worse. Hormones can be a contributor. Certainly bad eating habits, poor skincare routines, all of these things need to be overhauled. Most important, look at what's in the cupboard and what they're putting on their skin. If we can sort that out firstly, get the skin health restored to normal, then look at what we can do in terms of light therapy, medications we may use. Some people need antibiotics, some people need topical retinoids, some people need a combination of all three. It varies. And then most of our patients, we find that if we get on top of it early, they don't often end up needing that more severe stage of medication, which still is a very useful medication, but we want to get on top of it early.